And thanks, Mark, and also thanks to Pat for inviting me back. Much has changed in the world of global health since I spoke to you on May 20th, as you mentioned. Yesterday, known COVID-19 cases topped 100 million globally. And there have been over 2,150,000 deaths. Those statistics are according to the Johns Hopkins University Daily Tally. And as you know, there are now several coronavirus variants that first raised trouble in such countries as the United Kingdom and South Africa and Brazil. And I have to say, some global health experts are getting very worried. And this has actually increased attention to what I'll be talking about now, what is called the ACT Accelerator. Um, Internationally, the major effort aimed at helping low and middle income countries is the ACT Accelerator. It's an Access to COVID-19 Tools Accelerator. It's a groundbreaking effort. It's organized into four pillars of work: diagnostics, treatment, vaccines, and health system strengthening. And the vaccines pillar is COVAX. And you've probably heard that term if you're following the international aspects of the COVID-19 crisis. That has three co-leaders, the Coalition for Epidemic Preparedness and Innovations, or known as CEPI, Gavi, the Vaccine Alliance, and the World Health Organization. And they're working in partnership with developed and developing country vaccine manufacturers. It's the only global initiative that is working with governments and manufacturers to ensure COVID-19 vaccines are available worldwide to both higher income and lower income countries. And I'll be talking today in terms of that global perspective, since I'm sure all of you are well aware of what the situation is domestically in the United States. But that COVAX vaccine pillar currently estimates that they have a funding gap of around $4 billion, and it may end up being much more as needs increase for this year. The funds are needed for vaccine research and development, procurement, and delivery. One of the big issues out there, as many of us have predicted from early on in this pandemic, is what some are calling vaccine nationalism. And here I'd like to quote actually from the speech that the WHO Director General, Dr. Tedros, gave to the WHO Executive Board on Monday of last week at the opening of their meeting. It was really quite blunt. He said, quote, "As the first vaccines begin to be deployed, the promise of equitable access is at serious risk. More than 39 million doses of vaccine have now been administered in at least 49 higher income countries. But just 25 doses have been given in one lowest income country. Not 25 million, not 25,000, just 25. That country was later identified as Guinea, and Mark was telling me that this is something that but he's heard that they are now getting some vaccines, and so they can increase that number above 25. Tedros went on, "I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries. Even as they speak the language of equitable access, some countries and companies continue to prioritize bilateral deals, going around COVAX, driving up prices, and attempting to jump in front of the queue. This is wrong," he said. "This could delay COVAX deliveries and create exactly the scenario COVAX was designed to avoid, with hoarding, a chaotic market, an uncoordinated response, and continued social and economic disruption. Not only does this me-first approach leave the world's poorest and most vulnerable at risk, it's also self-defeating. Ultimately, these actions will only prolong the pandemic, the restrictions needed to contain it, and human and economic suffering. Vaccine equity is not just a moral imperative, it is a strategic and economic imperative. A recent study estimated that the economic benefits of equitable vaccine allocation for 10 high-income countries would be at least $153 billion this year, rising to $466 billion by 2025. It's not too late. I call on all countries to work together in solidarity to ensure that within the first 100 days of this year, vaccination of health workers and older people is underway in all countries. It's quite a strong statement by the Director General of WHO. He's been expressing concern since the very beginning. Back in January of last year, he was expressing concern about what would happen when COVID-19 hit the developing countries. He himself is from Ethiopia. But he's obviously very concerned. And this is, to me, it's a fundamental issue, but also a very intellectually challenging issue, because how can you not, if you're a head of state or a head of government, how can you not prioritize protecting your own people? And yet, the economics of it mean that this pandemic will go on globally if you don't get some vaccines to those who are most vulnerable in all countries in the world, because you want to get economies back, and it's really a global economy, including trade and travel. It's a very tricky issue and a tricky balance. COVAX, I thought, was pretty cleverly designed to try to meet that balance where countries could give in-kind or cash contributions, but it's obviously having its difficulties, as Dr. Tedros talked about. So in that context, globally, we have changes in the United States just a week ago. So I think for those of us who follow global health closely, this has just been an amazing sea change, even just in the first 3 days of the Biden presidency, in terms of the US international approach to this pandemic. As he had promised, on January 20th, US President Joe Biden sent a letter to the UN Secretary General, Antonio Guterres, retracting the US government's letter that was sent on July 6th of 2020, notifying the UN of its intent to withdraw from WHO a year later. Biden retracted that and said, and I'm sorry, but I'll quote again, "The WHO plays a crucial role in the world's fight against the deadly COVID-19 pandemic, as well as countless other threats to global health and health security. That the United States will continue to be a full participant and a global leader in confronting such threats and advancing global health and health security." So this was not only a strong marker that the US will stay in WHO as a member, but also supporting the work of WHO. And then the next day, the 21st of January, the Vice President, Kamala Harris, spoke by phone with WHO Director General Tedros. And she discussed the US decision to reverse its withdrawal from WHO in one of the first acts of the new presidency, and its plan to fulfill its financial obligations, something that we at the UN Foundation follow very closely, and it's very good to hear, and to work as a constructive partner to strengthen and reform WHO. Now, I have to note that there was a national ABC News Ipsos poll that was released on January 24th that indicated the US action to re-engage with WHO was supported by 70% of those polled, but opposed by 28%, and that included 61% of Republicans. My big fear is that US membership in WHO in years ahead could become a political football, which and changing depending upon which party's in power. And I think that would just generally be a disaster for global health in general and for the United States. So I hope that as time goes on and with WHO making reforms, which I'll talk about later, that a broader swath of Americans in the months and years ahead will come to understand and appreciate the work of the World Health Organization and how it benefits Americans. The day that Dr. Tedros and Vice President Harris talked, January 21st, Tony Fauci, who is, as you know, has a new position now as the president's chief medical advisor, in addition to his role at the National Institutes of Health, He addressed the WHO Executive Board, which had been meeting since Monday, and via Zoom, of course. And he said, quote, "I join my fellow representatives in thanking WHO for its role in leading the global public health response to this pandemic. Under trying circumstances, this organization has rallied the scientific and research and development community to accelerate vaccines, therapies, and diagnostics, conducted regular streamed press briefings that authoritatively track global developments, provided millions of vital supplies from lab reagents to protective gear to healthcare workers in dozens of countries, and relentlessly worked with nations in their fight against COVID-19. That's quite an endorsement from Dr. Fauci also. As I said, this discussion that occurred on the 21st was part of the EB meeting, the executive board meeting of WHO that began on the 18th. So in the first 3 days until 6 p.m. Geneva time on Wednesday, noon Washington time, the Trump administration had its representative in the seat. And then after that, the Biden administration had its representative in the seat. And I had this vision of the US delegate on Monday, the 18th, saying, "I want to assure you that the United States is leaving the World Health Organization on July 6th of this year." And then 3 days later, Dr. Fauci gets up there and says, "Never mind." It was a change that everybody knew was coming, but it was interesting to follow nonetheless. And for the first few days, and actually for the whole event, a career officer working in the Office of Global Affairs at HHS was really the leader in many ways of the U.S. delegation. And one other thing that Fauci said in his speech to the executive board on the 21st of January was that President Biden would issue a directive that day to include the United States' intention to join COVAX and support the ACT accelerator that I had talked about earlier. So the whole idea is to advance these multilateral efforts for COVID-19 vaccine, therapeutics, diagnostic distribution, fundamentally equitable access. And that was a very good sign for those of us who look on global health and how it affects countries all over the world. The other thing that went on also on January 21st, and that's as an aside, I have to say, when Pat was asking me what date I would like to speak to you on in January, I chose several days after the administration was put in place so we could just see how it had played out, but I never quite expected this many things to happen in the first few days. So also on January 21st, the White House released a National Security Directive 1, NSD 1. There's always a bit of a cachet when a new administration comes into place, and the very first thing they put in is whatever it's called. Sometimes it's a National Security Decision Directive, NSDD, or many other names it's gone by. But in this case, it's called National Security Directive 1. The subject is, quote, "United States global leadership to strengthen the international COVID-19 response and to advance global health security and biological preparedness." And I've done a fair amount of work on bio threats and infectious disease threats, not only in my role as the special representative on avian and pandemic influenza, when we were all going to die from bird flu back in 2006 to 2009, the H5N1 virus, but also more recently on a National Academy of Sciences committee on biosecurity threats. And I know the person who has returned to the White House, who's leading this effort in the National Security Council. Her name is Elizabeth Cameron. You may hear that name in the future because she's really excellent at this. She had been the senior director for biodefense and global health security in the White House at National Security Council at the end of the Obama administration, stayed on for the first part of the Trump administration, and then left to join a nonprofit organization, the Nuclear Threat Initiative. If you've ever seen the Global Health Security Index, she was really the one who spearheaded that. and really did a lot of work to create that. She's now back in government, basically in the same job she used to have as the Senior Director for Biodefense and Global Health Security issues. Um, and she clearly has a role to play in this new NSD-1, National Security Directive, but also I would bet had a big hand in drafting it. It takes a whole of government approach, and that's something that I'm sure all of you would appreciate because this whole of government approach is one that's uh, uh, those of us who've worked in the State Department in particular appreciate, and actually anybody who's worked with the U.S. government abroad, as many of you have, you just look at how the range of the U.S. government efforts are so important, and coordination is needed, but it's very seldom that something is just an issue is so narrow and vertical that it just affects one U.S. government agency. That's particularly true for pandemic preparedness and response, and you can just see how important that is for all U.S. government agencies to be involved in this, and the whole American populace is involved in this. It affects school teachers. It affects the federal government, the state governments, the local governments as they try to ramp up vaccine processing, et cetera. This really is a whole of government and whole of society pandemic, which is why I actually am quite pleased by this new National Security Directive in its whole of government approach. It looks to the health, the diplomatic, and the humanitarian responses to COVID-19. It brings in issues such as food insecurity, gender-based violence, the disproportionate impacts on marginalized and indigenous communities and on women and girls. It's really looking at the broad range of issues that have arisen throughout this pandemic. And very importantly, to my mind, it's not narrowly focused on the immediate problem. It calls for long-term measures to advance global health security, which, as you may recall, was one of the themes I had in my presentation to you last May. And that includes the global health security agenda. It asked that the U.S. Play a stronger leadership role in that. It was the creation of the Obama administration, kept on by the Trump administration, although I must say, I never heard it mentioned since COVID-19 began. It's, even though it would have been appropriate to bolster it and mention it, it's a group of about 70 countries that have worked together to improve efforts to prevent, detect, and respond to infectious disease outbreaks. And the GHA and this National Security Directive also talks about issues such as antimicrobial resistance and fighting climate change as a driver of health threats. The #1 section of NSD-1 is entitled Strengthening and Reforming the World Health Organization. So that's clearly a theme from President Biden's letter to the UN Secretary General on his first day in office, from the readout that the White House gave on Vice President Kamala Harris's discussion with Tedros the next day, and from Dr. Fauci's speech to the WHO Executive Board to strengthen and reform the World Health Organization. Now, with that, I'd like to talk a bit about the international scene, where things stand internationally in that regard. With these big changes in the U.S., they certainly support what is already taking place internationally. There are a couple different entities, several. I'll just talk about 3 of them for this purpose. One is called the Global Preparedness Monitoring Board. And I must say, Gro Harlem Brundtland, former Prime Minister of Norway, former Director General of WHO, is the co-chair of this, and she's a member, vice chair of the board of directors of the UN foundations. So just to be candid about that, the GPMB, Global Preparedness Monitoring Board, is co-convened by WHO and the World Bank. It's an independent monitoring and accountability body, and the whole purpose is to ensure preparedness for global health crises. They issued a report in September. They had issued one a year earlier, and this last September was called "A World in Disorder." And in that report, "A World in Disorder," they provided a really harsh assessment of the global response to COVID. Understandably, they warned that the world cannot afford to be unprepared again when the next pandemic hits. And they called for 5 urgent actions to be taken to bring order out of the catastrophe and chaos that's currently facing the world, which they thought were these 5 urgent actions should be responsible leadership, engaged citizenship, strong and agile systems for health security, sustained investment, and robust global governance of preparedness. There's also another group that may have a greater impact on the immediate sense because it was appointed by the WHO Director General after the World Health Assembly last May asked him to prepare an impartial, independent, and comprehensive evaluation to review the experience gained and the lessons learned from the WHO coordinated international response to COVID. That is now called the Independent Panel for Pandemic Preparedness and Response, known as IPPR. It's led by 2 former heads of state or government, the former Liberian President Ellen Johnson Sirleaf and former New Zealand Prime Minister Helen Clark, an impressive group. And just before the WHO Executive Board met beginning last week, Monday, they released their second progress report with a basic message similar to what the Global Preparedness Monitoring Board had said. The world was not prepared and must do better. And they talked about public health measures are needed and need to be applied comprehensively, that the pandemic response has deepened inequalities. The global pandemic alert system through the international health regulations is not fit for purpose, and I'll mention a bit about that later. There has been a failure to take seriously the already known existential threats posed by pandemics. And WHO has been underpowered to do the job expected of it. The panel believes that the COVID-19 pandemic must be a catalyst for fundamental and systemic change in preparedness for future such events from the local community right through to the highest international levels. So they've only done this through their interim report. The final report should be out by May for the next World Health Assembly. And a change is coming, I think. Now, how much change is a question. How much can be accomplished? In my more optimistic thoughts, I think that this was such a wake-up call for the world that there will be a fundamental increase in the amount of money that goes toward pandemic preparedness and response, and in a broader sense, what is termed global health security. There will be an understanding that we have to strengthen health systems all over the world, and that while it'll never be put on a par with the amounts of money that are spent every year for defense spending, my hope is that there will be a greater understanding of the need for regular appropriations to provide for robust funding of global health security needs, both domestically and internationally. But at the same time, there are limits as to how broad the international community will go, or how robust it will go in terms of the changes it would accept in some of the policies and regulations. And with that, I'd like to talk a bit about the international health regulations, which I had mentioned last time as being the cornerstone of international public health and health security law when they were first approved in 2005. Also, as a result of the pandemic, there is now an IHR review committee, and the World Health Assembly was assured when it met in a resumed session in November a few months ago that these efforts, such as the IPPR that I mentioned earlier and this IHR review committee, are coordinating and complementary of each other. And now, under these regulations, the international health regulations, countries agreed to establish ways to prevent, detect, and respond to public health emergencies, including building their own capacities for surveillance, diagnosis, and response. And they committed to notify WHO within 24 hours of the emergence of potential public health emergencies. But over the years, since that they were first approved in 2005 and went into force in 2007, high-level political support and resources for implementation of the regulations have been insufficient and irregular at both the national and international levels. As you may recall, in January of last year, on January 30th, WHO Director General Tedros declared COVID-19 was a, quote, public health emergency of international concern, PHEIC, which is known as FAKE. That was his way of telling the world that this pandemic is coming. It's an emergency. And he did that under the auspices of the international health regulations. But the drawn out and sometimes controversial process of deciding when and whether to declare a fake has been criticized. In fact, Tedros has been criticized for not having done it a week earlier. And so many have argued that there should be an intermediate level of alert for declaring a fake, which I think is likely to be accepted, that instead of having to meet criteria that this is really international and global, and that there should be some intermediate level that could be announced by the Director General of WHO. And the review committee on the functioning of the IHRs is looking at that and many other issues. But I've also been in some conversations here in Washington, D.C. with people who would like to do more. They would like to have the World Health Organization have the authority to send in a team when there's an incipient infectious disease outbreak, even if the country doesn't want the team to come in. And I think national sovereignty will end up being a major factor in how these regulations could be revised. And the two examples of that I'd cite that make me wary of how much power the World Health Organization will really get in the end are from China and Russia. On January 5th of this year, as you may have seen, Tedros said he was very disappointed that China still had not authorized the entry of a team of international experts to examine the origins of the coronavirus. Finally, China agreed to it, and just now they're really beginning their work after they had to go through a 14-day quarantine. It's not clear to me that China would allow any team to come in that it hadn't vetted and thought that it was ready to accept. The other thing, maybe even a more ominous sign for changing these international health regulations to make them more robust came on January 19th when the Russian representative to the WHO Executive Board, during the discussion of the international health regulations, made a very strong statement. He said Russia is, quote, categorically opposed, unquote, to a mandatory mechanism for external evaluation under the IHRs. And he said, quote, we do not see any need to revisit the IHRs, unquote. They instead emphasized the importance of implementing the existing IHRs to build strong capacities. Now, I predict that Russia and China and some other countries who may be reluctant for broader changes in the IHRs and who would resist any effort that could intrude on their sovereignty will likely agree to smaller changes, such as creating an interim level of a warning short of a full-fledged public health emergency of international concern. But this is another area out there that is important because, as I said, the cornerstone of global health security in a lot of ways is the rules and procedures within the international health regulations, and even more importantly, building the capacities to meet the requirements of the IHR. So in conclusion, in the modern world, every major threat and risk is globalized because the world is linked through travel, economies, and communications. This is not philosophical, it is practical and real. In this situation, a multilateral approach to health, to my mind, is critical because each country by itself does not have enough control to manage the threat or risk by itself. COVID-19 being a clear example of this. No nation is safe from COVID-19 resurgence or a future pandemic until all countries have the ability to bring it under control. And that's why I welcome this new initiative by the United States president to improve global health security, not only by staying in the World Health Organization, but by working in it to reform the organization and by building up global health security through a whole of government approach that involves all agencies of government. So I'm very concerned about the near future. The COVAX facility needs much more, and I'm very worried about people in poorer countries being last on the list to get vaccines and suffering disproportionately. I do, in the long run, have a lot of optimism that multilateral approaches will serve to mitigate the most damaging effects of not only this pandemic, but future pandemics that we know are inevitable. So I have hope, and let's see how this unfolds in the months and years to come. Thanks for listening.